Welcome to the watching this video. We're going to start with some introductions. My name's Ruth Hawley. I'm a lecturer at the University of Derby.
My name's Carol Smith. I'm an OT lead in Midlands Partnership Foundation Trust, and I work in the clinical area of early intervention in psychosis.
I'm Gayle Jarrett. I'm a Band 6 occupational therapist working at the same trust as Carol, and I work in the psychosis pathway.
I'm Hannah Spencer, newly qualified occupational therapist, and completed my placement during the kind of height of the pandemic with Carol and Gayle.
Thank you. So the aim of this was just to give us a chance to be able to talk about your placement experience. And I thought, first of all, probably more for Carol and Gayle, if you could just tell us a little bit about the history and the context of that and how the placement came about.
I think we just said yes, didn't we, Gayle?
Yes. That's the right answer every time.
I don't think we really put an awful lot of thought into it. I think that we just knew that placements were going to be in short supply and that we already had the technology set up with the platforms that we were using to be able to support a student in a different way.
I'm expecting there to have been some other changes that you had to make to how you offered the placement that reflected the COVID context of it.
Yeah, so obviously the amount of face-to-face contact was reduced significantly, and so the amount of face-to-face time that a student was going to get with patients was limited. So we had to think quite a lot about the kind of interventions that a student would be able to complete that wouldn't necessarily be face-to-face, and that included phone calls and over a virtual platform that we use called One Consultation. I think what we hadn't factored in was how quickly, and partly this was to do with Hannah and her proactive way of working, what we hadn't factored in was how quickly we would get the groups up and running for people to be able to access groups over Microsoft Teams, and that that became a big part of your placement, Hannah, didn't it?
Absolutely. So I had done a term in uni of virtual learning, and I think skills that I had learned at uni definitely I brought to my placement. And I think right from kind of day one I was saying, oh, we could do this, we tried this at uni, it works, let's try this.
Yes.
It was really invaluable to have Hannah as part of that group. I mean, the group that she was a part of was already underway when she started her placement, and we managed to gain consent from the service users who were attending the group for Hannah to sort of observe and be a part of that session. But she did so much more than that. You know, her knowledge of technology and how to provide a more interactive experience for the service users was really invaluable, and was something that the service users commented on in their feedback forms. In preparation for our meeting today, I was thinking about all the things that, you know, had occurred during Hannah's placement, and so many things that we did are things, as you say, that happen naturally on placement anyway. It's just that there's a different set of circumstances happening around us, so we just adapted to it.
It did work quite well, that balance, didn't it? And being flexible within that worked quite well, and I think that perhaps worked better because of the virtual element of a lot of the work.
Maybe I also got the benefit of the input of lots of different OTs because of COVID, so there was like limited patient contact, which meant that I jumped in on as much patient contact as I could, which meant having the benefit of working with other OTs as well across the patch. So probably did more patient contact across the placement than individuals themselves.
Yeah.
And I think that point's really interesting, because I think understandably, there's lots of challenges that people are facing in offering placements at the moment, but one of the ones that we hear about a lot is people worrying about the reduction in placement contact that students are experiencing. And I was interested to know your perspectives on that, having done a placement, and yeah, just what you thought about that aspect.
I think probably at the time it felt that I was doing less, or I had less patient contact, but actually reflecting back on it, like I've just said, I had the benefit of working with 4 or 5 different OTs and working with the people that they were working with, as well as plenty of opportunities for interprofessional working. And if you think about the groups that we were doing and the amount of people that I was interacting with during the groups, you know, I had plenty of patient contact.
So we did have face-to-face contact with people during Hannah's placement, and obviously that was wearing the correct PPE and maintaining social distancing, and we you know, we were able to make it work in that way. And because Hannah was a car driver as well, she had a reasonable amount of independence with some of those visits as well.
That's something that was a pro and a con, wasn't it? Because it was a pro in terms of it made me be independent because I got no choice, but it was a con in terms of I lost that kind of in-car supervision time that I've previously found really valuable.
I mean, we set supervision up in much the same way as we would normally set supervision up, and we had a set time every week when we did supervision, but that was obviously over Teams rather than face-to-face. Yeah.
So what were the things that were the biggest challenges?
I think perhaps one of the biggest challenges was about linking in with the wider team, because we can't all be together in terms of making sure that we were meeting the objectives of the placement, given the circumstances we were working in. I think we were mindful not to plan too many things with other disciplines.
So I think my challenge was that lack of ad hoc conversation and that lack of ad hoc supervision, and that risk of feeling disconnected and having to own my needs, I guess, a bit more.
I think for me, the biggest challenge was at the start, before you'd even arrived, just anticipating the potential problems and worrying about making sure you were going to be looked after and that your needs were going to be met by the placement, and making sure that you had enough opportunities to be able to learn. And so my initial kind of, you know, hesitancy was probably the biggest challenge for me about the placement, and thinking, oh, perhaps in these current times we don't do it. But I'm so glad that we did do it, because it's proven to us all really that it's possible, you know, and it's achievable, and you're now, you know, a qualified member of the staff team, so, you know.
And I think that aspect of it, Gayle, that pre-anticipation of how can we make this work, I think that's where a lot of people are sitting.
Some of the spaces where there was a bit of time, it was like extra opportunity to properly get my head into that professional reasoning, to pull apart things a bit more, and to get stuck into the theory and why have we done that and why have we done that, that maybe in normal circumstances perhaps we just get swept away with the doing because that's what we do. So pulling apart the why a bit more.
To blow our OT trumpet, you know, we are OTs and we do problem solve and think outside the box all the time. You know, it's what we eat, sleep and breathe, isn't it? So there's always a way around a potential problem. There's always a way of doing something a little bit differently. And that's something that I've kind of kept at the forefront of my mind, thinking about having students in the future, that, you know, there's a way to make it work.
Yeah. Thinking about what we can do, as opposed to what we can't do at the moment.
There will always be reasons to not do it. There will always be things about time and about resources and staff, but you know, there are lots of opportunities for you to make it work as well.
And I really liked that aspect that you said, Gayle, about actually OTs, this is what we do, we're innovators and there's a way. And it, to an extent, it feels like you've enjoyed the creative process of that as well.
Mm-hmm,
Definitely.
So are there any other top tips that you would give to people?
Just be brave with it and just go for it, I think, is the message. Because once the placement's underway, you know, it evolves naturally and you make it work. You know, obviously there's lots of planning involved to begin with, but I think if there's a willingness on all parts to make it work, it will work.
Yeah, no, I was just going to echo what Gayle said, really, that, you know, just saying yes to the placement and not really thinking too deeply about what we can't do at the moment, but focusing on how we can adapt and how we can overcome some of the barriers that we've got at the moment, and that as OTs is what we're good at. That's our bread and butter, isn't it? Mm-hmm. So it gets us into our OT heads and thinking creatively about what we can offer and how we can go about doing that. And as Gayle says, as long as we're all on the same page, the educator, the student, the uni, it can work and it can be really successful.
But I think that aspect of students seeing the changes that are happening in practice so that they're then ready to come out into practice is really important.
Absolutely, yeah. Being used to the way that we're working at the moment and being able to adapt to the way we're working at the moment is crucial, isn't it, when you're faced with coming out into practice. Yeah.
None of us know how long this situation is going to last and how long we're going to need to work in this way. And there's certainly things from our own reflections in the way that we're working currently that we'll probably keep once COVID is a long, you know, past distant memory. So, you know, I think it is a slice of the real world, if you like, when people come out onto placement at the moment, and hopefully, you know, it will stand them in good stead for when they're starting their journey as a qualified member of staff.